Good evening, everyone. We are back with our live session at Healer's Corner, and today we are going to discuss about how genetics and family history influence migraine. So, our guest speaker today is Dr. Mansi Choudhary. She is pursuing her BHMS from Antarbharti Homeopathic Medical College, Nagpur. She is also a science and biology educator, and she content and study techniques in her channel called Mansi Tricksters in YouTube and Instagram. And Dr. Kamlesh sir, who is a renowned homeopath practicing in Nagpur for more than 16 years now. He is well known for his success in treating most difficult pathological cases. He is also a member of World Institute of Sensation Homeopathy. So without further ado, we'll start our today's session. Over to you, Dr. Mansi.
I think she is not in meeting somehow.
Mm, I'll check again. So we can start, Dr. Mansi.
Yes, ma'am. Good evening, sir. Good evening, ma'am. And thank you so much for giving me this opportunity to discussing the fascinating topic. Shall we start, sir?
Yes, yes, well.
So my first question is migraine genetic condition or how much it affected the individual with family history?
Okay. So first of all, Dr. Mansi, let me congratulate you and a lot of best wishes for the work you are doing, the teaching and biology and all teaching. This is really a great job and
Thank you, sir.
best wishes for your future journey. And so today's our topic is migraine, right?
Yes.
And we are talking about genetic connection between migraine and uh, genes. So my understanding of disease is like this: that genes decides how we look, what will be the color of our eyes, how will be our height, how will we function, right? Even our emotions, how will we think, what will be our prominent emotions, what will be the chemical changes in our body. All these things are decided by genes. Likewise, genes also decide the predisposition for specific type of diseases. Means if we have some disease, that means that our genes allows that disease to happen in our body, right? So in my understanding, each and every disease we have is related to our genes, because our genes allows that disease. Our genes are prone to or predisposed to that particular type of disease, especially diseases which happens recurrent again and again, or long-standing chronic diseases. This may also true for acute diseases, but some diseases are directly linked to our gene, and these diseases are called as genetic disease. But in my understanding, all diseases are linked somehow to our genes, directly or indirectly. So yes, migraine is directly linked to our genes, and
Okay, sir.
that's where it is found in some families. Like for example, one of the parent has migraine, then the chances of child getting migraine is 50%, 45 to 50%. If both of the parents has migraine, then chances of that child getting migraine is 70%, which is a very huge number. So this indicates that migraine is definitely a genetic condition, and it has a very significant role of family history.
So next, if the parents has migraine, then what are the chances that child also develop them? So that you have discussed 70% of the chances that child getting the migraine.
If
Okay.
both the parents has migraine, if any one
Okay.
parent has migraine, then 45 to 50% of chances.
Then, can environmental factor also affected the migraine sufferers?
So yes, behind migraine there are two type of positive factors. First one is genetic cause, which includes family history, and second is environmental factors. And there are a lot of environmental factors which may trigger the migraine. Like for example, stress. If someone is going through stress, or if someone has this tendency to take anxiety very easily. Some people are very anxious many times. Even trifles affects them. So there are a lot of chances that these emotions may trigger migraine. Second, sleep pattern.
Yes.
Mostly these anxious people, they have very disturbed sleep, and this irregular disturbed sleep pattern also triggers migraine. So migraine people must have sound sleep, so they must work on their mind, their emotions, and their sleep patterns also. Even certain foods like caffeine and processed food, packaged food, these may also trigger migraine because of some inclusion of some chemicals. Even dehydration causes electrolyte imbalance. As you may probably better know, that dehydration causes a lot of electrolyte imbalance. It may reduce blood flow to the brain, and that's how it may trigger migraine. Some weather conditions also. So basically, these people are very sensitive, and they respond to lot of changes in their surrounding, like loud noise, like lights, like uh, excessive screen time also. So nowadays, people use lot of mobile phones or laptop screens, and these lights are irritating sometimes. Even flickering lights, which we can easily observe in many parties, marriages. So these lights, these stimulus may trigger migraine. And there is a role of hormones also. Estrogen is the main hormone which may trigger uh, migraine. So that's why migraines are more in female comparatively male, because migraine is readily triggered by estrogen hormone. It is more during menstrual age, menopausal age, or with female who are consuming hormonal pills, OCPs, or like hormonal pills. And people with poor gut health, they also are prone to migraine conditions repeatedly. So these are some environmental conditions which may trigger migraine.
That means it's very important to maintain the diet and regimen to uh, maintain migraine condition.
Very true. Very true. Even our diet, our lifestyle, our routine. So these people, they must follow strict dietary and lifestyle routine. This is very important, along with medicine.
And so, how does homeopathy approach the migraine conditions?
Yeah. So basically, homeopathy is holistic science, right? So homeopathy uh, look at the person or sick individual holistically. What do we mean by holistically? That we consider patients' physical symptoms, patient's emotional symptoms, patient's predispositions, behaviors, how he reacts, how he perceive the situation. So we consider the patient as a whole. So in migraine situation also, as we have just discussed, that migraine is related to lot of conditions, right? Genetic conditions and environmental conditions. So basically in homeopathy, we consider all of these factors: past history, family history, environmental sensitivity to environmental conditions. And we consider all these factors to reach to the minimum medicine. And we try to find a medicine which is similar to all these factors. So in total, what we do is we consider the holistic points of that particular patient, and we try to match with the symptoms of that particular medicine, and then we prescribe this medicine, and that medicine helps the patient. So here we don't take the local approach, but we take holistic approach. What do I mean by local approach? Is that we don't prescribe like modern science the medicine, we just reduce the pain, or anti-inflammatory medicine or anxiolytic medicine, but we consider all the factors of that patient and we prescribe holistically.
Okay. Then, sir, can lifestyle modification reduces the risk of migraine,
Definitely,
predisposition of
yeah,
migraine?
definitely, because all these lifestyle errors are triggering factors. So we need to correct all these triggering factors. And when we will correct all these factors, then only we will be able to control migraine very effectively. If we are taking medicines and we keep on, for example, uh, night watching and lot of screen time and lot of stress, and we cannot handle all these things, so there are very minimal chances of migraine getting cured. So along with medicine, we need to take care of our routine. We need to maintain our sleep schedule. We need to control or avoid the foods which trigger migraine. We need to do meditation, yoga, and uh, calming meditative techniques which reduces our stress, anxiety, like that. And we must engage ourselves in regular physical activities without overexerting. Even overexertion may trigger migraines. So all these factors definitely help in controlling the migraine. But to cure migraine, we must treat that condition holistically, homeopathically.
So, can you please tell me the food and drinks that reduces the migraine condition that we are particularly follow in our diet?
So there are two parts of the answer, I can say. First is the regularity of consuming food, and second is type of food. So first of all, we should fix our routine of consuming food. Our times of eating food must be fixed. Morning 10 a.m., evening before sunset. And these timings must be very regular. Second, we must avoid irritating foods like caffeine, which may trigger migraine, or some packaged foods which have a lot of chemicals, processed food, and these chemicals may trigger migraine. So we should avoid these foods. Even I have observed, if you have some neurological condition, if you have headaches, migraines, or any neurological condition, then you should avoid sugar. Sugar is very dangerous for such patients. So these are the basic guidelines to follow.
Okay, that means punctuality is utmost important.
Very right.
Then, homeopathy remedies specifically targeting the genetical to, we can say that to fight against the migraine.
Yeah, so when we say that, first of all, migraine is a genetic condition, and genes, each and every individual has different type of genes, and it manifests in a different way. So each individual is different from another. First. Second, homeopathy is based on science, two principles, holism and individualization. What do we mean by this? That we consider the person as a whole and how it is different from another person. And when we say this, then we don't have specific for any pathology, any disease in homeopathy. I believe in prescribing on basis of individualization only, not on the basis of specifics. So we don't have any specific medicine. Those specific medicine may provide relief for some time, but if we want to really help patient and cure conditions like migraine, then we must take approach of holistic medicine. And without that, we cannot cure that patient. So answer to this question is no, we don't have specific medicines, but we have specific medicine for that person, not for that disease.
Yes, because we consider person as a whole and we consider that individually.
Right.
So then homeopathy offer a long-term relief to migraine.
Yes. As in homeopathy, we consider patient holistically and we consider all the triggering factors, family history, genetic predispositions, patient's personal history, emotions, and we consider everything. So we are able to act, means our medicine is able to act on each and every part of this uh, aspect of the patient. And that's why homeopathy provides long-term relief. I will say homeopathy can cure migraine. I have seen that homeopathy has cured migraine completely from patients suffering from migraine since long, since 15, 20 years even. So we can cure the patient when we take holistic approach in these conditions.
So I have seen many people that they doesn't follow the rules that a doctor provided him. That continuation of that particular remedy. So it's wrong. I mean to say.
Yes, very true. The first prescription is very important. But with that, follow up of that patient is more important than that. Because cure is not one-time process, it's a journey. And physician must follow the patient throughout this journey. So sometimes we may need to change the potency. Sometimes we may need to change the approach. We may need to change the remedy. So for that, physician must follow the patient and patient must take follow-up regularly for long term, long duration with that physician to get completely cured. This is very important. You raised a very important point.
Yes, that means cooperation between and relationship between the doctor and patient is very important.
True. And that uh, relation depends upon trust and the experience, what we are getting from that doctor or the treatment. So patient perceive the genuinity of our efforts. If we are genuinely taking efforts in treating that particular patient, if we are working hard on that case, if we have very genuine feelings that this patient must get cured. So patient sense that. Patient sense that aura. They can perceive that aura. And that's how that is this is very important. And the clear communication also. We must have clear communication. Patient has all the right to know about the way of treatment, what treatment is he is getting, and all the other aspect of his disease and health. So this communication, clear communication, is very important in doctor-patient relationship.
So one last question. What advice would you like to give them to the migraine sufferer and how to prevent and how to manage all those migraine things in our daily life?
So even if you have migraine, if even if you have family history of migraine, so there is uh, nothing to worry. We must need to understand our disease. We must need to understand what is triggering our disease and avoid all these triggering factors first. Follow healthy habits, lifestyle, diet, second. And third, most important is seek holistic homeopathic treatment. And holistic homeopathic treatment is able to cure your disease. So when you will follow all these three steps, you will be completely out of free from this condition.
Thank you so much, sir. You have given such a beautiful information to everyone that we have joining and my family also joining us because in my family there are very much migraine patient. Thank you so much.
Okay, this is very uh, helpful for all the people. I think mm, I really congratulate people, new budding homeopaths like you, who readily take part in such type of discussions, which are helpful for normal people, laymen also. So, thank you and bye bye. I think.
Bye bye.
Okay, bye
Thank
bye.
you for this wonderful session.